Hi, I'm Kelsey Boss, the founder of Compleo Wellness and mom of two. And I'm here today with one of our pelvic floor occupational therapists, Karon.
Yes.
And we're going to chat a little bit about a couple things with the pelvic floor and postpartum that doesn't always get talked about. I think a lot of times we talk about the diastasis, just like the strictly physical aspects of, do I have a separation or do I have pain? But a lot of those times those do play into more functional impacts that can affect our mood, how we're interacting with those around us. So what are kind of some things you're seeing if you're having pelvic floor symptoms that have that like psychosocial effect?
Yeah. So when we talk about a psychosocial effect, we're talking about what that's doing to your mood, to your mind. Postpartum, occupational therapy, also a really good PT, will do this too. We take a look at your habits, your roles, and routines. After baby, virtually all of those things are different.
Nothing is the same.
No,
after baby.
Nothing is the same. And it's all good things, but there are definitely some challenges in figuring out what's the new routine with mom and baby. How do we co-regulate with each other? What are my new habits forming for myself? You know, you might be breastfeeding, so your water intake needs to increase. Your diet needs to increase. And the role that you play as a person, it changes. And so what that can do to you mentally is a lot. And it's different for everybody. Something that I do specifically with patients is if I'm seeing a patient from pregnancy through postpartum, I'll do the perinatal anxiety screening, and then postpartum we'll do the EPDS, the Edinburgh postnatal depression screening. And that's just a way for me to keep tabs on mom, making sure she's doing okay. And it's very normal for me in my sessions to be able to take time with mom to be discussing those habits, roles, and routines and how they're handling them. And if they need some help, that's what I'm there for. And that's where OT really thrives.
Yeah. And I think that's so important. And I think with my first, especially, like you said, all those things change and you're told like you're going to lose sleep. All of this is going to change. But there's no way to really prepare for that. I don't know if my second is a more chill baby or I just was actually prepared for the fact that everything was going to be turned upside down so I can handle that a little bit better. How do you feel if there is pelvic floor dysfunction, which can be really common?
Yeah.
What kind of layer, how does that further affect those psychosocial components you were talking about?
Definitely. So, I mean, for one, we go to the bathroom, 6 to 10 times a day. If there is pelvic floor dysfunction, that's just naturally in your mind. It's going to be harder to want to go to the bathroom. Then XYZ problems can start happening. It can also affect you and your spouse, in the bedroom with your intimacy. And, postpartum, there's already a strain on your relationship a little bit. And, adding in some of that, if there's difficulty with intimacy, it can kind of spiral from there. And something that it's not really talked about, it's kind of looked at as taboo a little bit. But in pelvic floor therapy, we can address that too. Really kind of diving into why is your intimacy being impacted, how it's being impacted, what works for you with your partner, your spouse, to make sure that that's not an area that's failing as well. Because there are so many different things and there's already going to be a little bit of a difference in your relationship postpartum. And we just want to make sure that we can support it as best we can.
Yeah. I mean, it's so beautiful to bring a child into the world, but you don't really realize how it really does affect every aspect.
Yes.
So what would you tell the OB-GYNs who say, just have a glass of wine? I always thought that was like a joke. And then I realized like there really are people out there who kind of just brush these concerns to the side and say, you know what? Your body totally changed. You just need to have a glass of wine and relax. And so what do you wish you could tell the people giving that advice out there in the world?
Yeah. Put yourself in their shoes, would you give yourself that advice? Maybe some people would say yes, but if there's, that's like a Band-Aid. And we want to avoid that. If there's something really serious going on that's impacting your intimacy, impacting your relationship with your partner and your spouse, it's worth having it checked out. Whether that be pain, be it, you've just had a baby, your anatomy has changed. And that's not something that you can avoid. And so, that could just be impacting you as well, getting a feel of your new body. While yes, that is beautiful in its own right, it can definitely have an impact. So if you are someone who is giving that advice,
please stop.
Please stop.
Please stop giving that advice. And then, kind of outside of that, I think that's a really important one that just doesn't get talked about a lot. And people need to know there is help for that, both from perinatal counselors and occupational therapists and PTs. What about other like psychosocial components? Like you mentioned, when you started talking, you just mentioned like co-regulating with baby or things like that. So what are some other psychosocial components that you feel like the breathing or the pelvic floor therapy can help improve? Yeah,
so a lot of what I do when I'm working with patients is really trying to help them create more mindfulness of their body, mindfulness of what they're feeling, when they're feeling it, how their body is feeling in space, and being able to listen to their body. So the breathing helps not only with that thoracic and abdominal mobility, but it also helps them being able to understand what's going on in their body a little bit more. If you are in a dysregulated state, and baby's in a dysregulated state, there's going to be on this nervous system level that we can't see dysregulation. And so really for mom being able to have tools to be mindful of where she is in her body, that only helps her relationship with baby.
Yeah, someone was actually telling me the other day about some new information coming out that like colicky babies have higher anxiety moms. And I think there's still some stuff emerging on that, but that co-regulation piece, because if you have that baby who's fussy and colicky and then you're getting ramped up, it is really nice to have tools like that breathing that can regulate both of y'all, because I think with our first we would just spiral. I didn't have a lot of these tools with our first, and he would just be crying, and then you're like bouncing faster on the ball, like how do I get you to calm down? And then I think we just fed off each other versus just taking a deep breath. And our second, when he gets fussy, like I just like hold him and take deep breaths, and it does come down a lot quicker. Maybe it's baby personality. I know it's a combination of things. There's no magic wand for a colicky baby, but it's nice to know there are some tools out there to help mom and baby. And
I will say, even having had the tools with my first, I still didn't connect all the time because with your first, it's just new. Everything changes. And so it's okay. There is grace. And I know we say that all the time, but there truly is grace in that very first baby experience. But I have the same experience with my first. She's a little bit more high strung than my second. And I think too, that just is an indicator of where I was at mentally with both.
Yeah. I would definitely agree with that statement, Ines. Well, thanks so much. I really want to encourage all of y'all watching out there that there are resources. So if you are struggling in any way, whether that's emotionally or more physical symptoms, a pelvic floor OT can really help bridge that gap of both the psychosocial piece and the physical symptom piece. But please get yourself resourced if you are struggling. And also, hopefully these conversations remind you that there is no normal, everything changes. And that if you're experiencing it, someone else out there is too. So please don't just brush aside your concerns.